Hi, everyone. Welcome to the Majlis. My name is Yasmin Al Khoyatlar, and I'm especially excited to be partnering today with MaintCon to host a couple of special episodes live at the conference. So we're filming right now as it goes around us. And very honored to have Her Highness Dr. Ahad Al Saud with me today. Thank you so much for being here.
It's a pleasure, trust me.
It's a real honor to have you here. Dr. Ahad is an emergency physician assistant professor at King Saud University, in addition to being the chief medical officer of all motorsports events in Saudi, like Formula One and E. And finally, she's also chief operational officer of the Saudi Automobile and Motorcycle Federation. So a really cool overlap of, what we see as traditional healthcare and then what we see as primetime entertainment, essentially. And I would love to hear from you, Dr. Ahad, how you got into this space.
I think it was a nice coincidence. So I had a friend that invited me to Formula Race, and I loved the organization there. And then I had another friend who's actually here in Bahrain. His name is Dr. Amjad Abed, and he's the CMO of the Bahrain Motor Federation. He said, "Come on, come here, visit us, and I'll show you the formula and what we do." So I went there, and from a perspective of the medical point, I just was so in love with the concept of organization and collaborative teamwork, effective teamwork. And this was an eye-opening to me. Like, oh, I'm so hooked, and I loved it. And I persisted with them and continued. And that's how I got into the motorsport industry.
Very interesting. And of course, it was very lucky that the timing of your interest in this also coincided with the beginning of Vision 2030. And how did that look like? So, you've been working in the healthcare field prior to the announcement of the vision, and you're working in it now. How has that evolved over time?
It's an amazing progression and empowerment to women, and especially in the health sector, let alone the entertainment and motorsports.
Okay.
I felt so proud to be part of this change, and it's very fruitful on all levels. A lot of people started to ask about how can we get involved and to integrate the medicine with the entertainment and motorsports. And I was really happy to have that change.
Incredible. And what has that change primarily looked like to you, and particularly in the healthcare sector? So, how would you characterize the healthcare sector before compared to now?
You could say that more women were introduced into the other options of the medical field. Let's say if you're on call, servicing in a hospital, some difficulties or some barriers where you need to wait for a driver or get an Uber so that you could go to the hospital. Now it's more easy for them to just drive and jump over and just go to the hospital, and they're more independent. They're competing with the guys actually for this. It changed in that perspective. The other thing is that not just for, let's say, driving, but the Vision 2030 made a big collaborative change, and a lot of female started to submit requests to be part of medicine, get introduced to other specialties that were, let's say, male dominant in the field of medicine. Surgeons, for example. We have amazing trauma surgeons that are female. So this is all changed in the medical field.
And the, increased presence of women in the workforce is one thing. As when we look at it from a public versus private lens, do we see an increase in privatization of healthcare without losing necessarily the public sector's safety net?
So when this happened, there's a big boom in the health industry. A lot of clinics opened, a lot of private hospitals opened, and it started to have this good competition with the government sector. So the government sector is upgrading their standards, and even the private sector is trying to have the more, let's say, options and capabilities. And although we had COVID, but that was so beneficial to the health sector in general, with enabling them now to, right now we're having what's called the unified medical record, which is so easy when you go to private sector, public sector, your record is there, and it increases patient safety and improved care.
That's very interesting, because you don't normally hear someone say COVID was good for something.
Well, that's It's, well, you see, with everything that's, let's say, if something bad happened, you really have to look at the silver lining and figure out where we could use this setback to promote us forward. It's like an arrow. You have to pull it back to go forward. That's what I would say.
And I think in particular, it really highlighted, I mean, we're talking about the intersections of healthcare with different sectors in the playing field, the intersection with technology. I mean, the efficiency with which we sort of, had all of these apps in order to be able to check on our health, to be able to make COVID appointments and vaccine appointments was unlike anything we've seen abroad even. So I would really say, I don't know if you join me in saying that, the e-services part of the medical sector here is much more advanced than the rest of the world.
I would say the public e-services, not the private though, but the public e-services are surpassing a lot of countries. I was during the COVID area in the United States, and the COVID vaccine was a card that's written by hand, and
I had that card.
yeah, so that's like, really, that's it.
Yeah.
And there's no stamp on it. There's nothing that authenticates it, but that's the best they could get for like the mass public there. And when I came to Saudi, it's like, oh my God, they have it on the app. There's like an app and it's linked with your ID. This is so cool. But yeah.
No, I've had that similar thing because I moved back here towards the end of COVID, like in 2022. And when I came to the border crossing here and I showed them my little paper and they were just like, what is this? Like, why don't you have this digitally? And I was like, I'm sorry, I'm coming from the States. It's the best they could do. But in, yes, obviously there are a lot of areas where we're surpassing the rest of the world or, matching global standards. Where do you feel that the healthcare sector here could still, where is there room to explore further? Where's there room to step up?
Okay, I think there's more room to upgrade, let's say, the e-services. But there's also this movement to cover up the less serviced areas in the region. So people know the kingdom, Riyadh, Jeddah, and the eastern province, where the Khubar, Dammam. And there's certain regions that really need more support in healthcare sector, and that's the northern region, southern region. These are highly active regions with the healthcare and population. There's a lot of population there, and they started. You could see the difference in the southern region. They have really good doctors there right now, and the infrastructure is improving. Newer hospitals are being built. Task force are being made. I'll give you an example. Al-Ula is a tourist area. The hospital there was not one of the best hospital, but it's like a secondary hospital. They upgraded the system, and this is also beneficial because what happened is there's this big change that in the health sector, there's now Saha Al-Qabida, which is the corporate end of the Ministry of Health, and this boomed the standard for that hospital in Ula, and now it's more efficient and setting an example for other regions so that they could upgrade.
Interesting. Yeah. So to view a hospital as a business, essentially, in order to be able to make it more efficient.
That's one element of it, but it also promotes the number of people that graduate from medical school and from subspecialties. There's a lot that are just hovering, not working in any region. So this actually gets more working force to employing them and strategically deploying them and utilizing all the needed manpower for this upgrade.
And this is based purely off of what I hear anecdotally, so correct me if I'm wrong, but it feels like medicine is one of those fields where Saudization has not been as much of a struggle, where we have a great local workforce.
That's what's apparent prior to, like, if you go 15, 20 years back, you wouldn't see a single Saudi nurse in major hospitals. Now, as an example, I have at least 12 to 15 nurses in the department that are Saudi, male and female. The doctors also, the last batch has more females than the male counterpart, but this is booming and people want to work. It opened up to other options. Nurses used to, and physicians, female physicians, are hesitant to work in private sectors at the beginning. So now they're more prone to go, like, let's do this. Let's explore. Let's benefit the whole society by giving our support and need and our knowledge in this field.
Amazing. And you sort of also work at this nexus of the public and private sector when it comes to healthcare, right? So what is that relationship like?
That's an interesting relationship. You see, when we're talking about purely entertainment, this goes into a couple of subdivisions in emergency and public health and also disaster management. So this is like a very nice collection of medical services provided. So let's say it's a mini hedge event in every colossal entertainment event. For example, big matches, concerts, all of that. They're the same. You have 40,000 people in one little area and you need to provide medical services. Well, not comparing to hedge, but it's big. And this goes with mass gatherings and disaster management. The collaboration between the government sectors, the police, the Saudi Red Crescent, the hospitals, general and private hospitals, public hospitals and private hospitals, to collaborate and work together to make sure that everyone gets covered and success is maintained by having less casualties and better support in case something happened or in those events. But it's an interesting combination, and you learn a lot. You learn a lot.
In terms of cooperation, management.
Yeah, and this is the transfer of knowledge and the collaboration between the sectors. So I would say, no, this is not a good idea. And I would explain my point of view regarding, let's say we need an evacuation route, for example, from A to B and should be blocked. And like, no, that's going to cause chaos to the traffic. Like, yeah, but there's an alternative route. I need this because of this. And now they're like, yeah, okay, that makes sense. So a lot of people, after working with them multiple times, they know the basic standards for, let's say, the medical care, what's needed there, and the collaboration is just amazing. It's off the charts. They're just amazing. The military personnel and the police, they're just amazing. Honestly, they're very supportive.
Yeah, and I mean it's understandable because we're building this so completely greenfield. I mean, who would have thought even a couple of years ago, Formula One races are going to be held in Saudi. So you really have to set the standard for everything, and then you at least have the chance to set that bar very high, right? In terms of safety. I mean, I'm not someone who's especially into race cars, but I imagine that there is high risk involved, and to be able to manage all of that is a huge responsibility.
Yeah, the FIA, which is the Federation International Automobile, which is the international federation for cars, and these competitions set a high standard for the medical care. But from a perspective that people don't know, that our standard medical care is actually higher than what's in these regulations.
Wow.
So this is something I'm super proud of. So,
mashallah. And I think, people underestimate how high standards are here for even the most basic things. And I think maybe we can talk about that as well, because you mentioned that you have gone into sort of the industry, the corporate crisis management space. What's that like?
So that's something I discovered, that I have this, I can figure out a problem and identify what the cause is faster than others or my peers. And I said, okay, I'm interested in getting to deep dive in it. So I took something called corporate crisis management. And this helped me get more involved in the business culture and business terminology and how things get affected by the chemistry between these divisions and departments. And it's basically back to going to teamwork and team building in one way or the other. And the number one culprit in any crisis related to any business is usually communication.
That makes a lot of sense. And you're the CEO as well of the Automobile Federation. COO, yes. Yeah. And what does that look like as someone who comes from a very strong medical background as an assistant professor at a university? What is that shift like? What are your responsibilities there?
So being available for the teams, making sure that the events and the synergy between the regulatory body and every aspect of the entertainment events the security, the governmental relationships work together to make any event successful. That's one thing. The other thing is a collaborative effort of team building, and making sure we got the right person in the right place to do the right thing right. And also how you change the culture in a way that benefits all these sectors. And if you ask me about how my work happens, and sometimes I would be in 4 cities the same day. So I would go, for example, from Riyadh, Qasim, Tabuk, Jeddah, or somewhere else. That involves a lot of driving and going to a couple of areas, looking at some certain aspects of how things are going to operate correctly, making sure that what's required is shown and covered, and all these tiny aspects.
Of course. I think that brings us back to a good point you also mentioned earlier of Saudi is bigger than Riyadh, Sharqiya, Jeddah, right? Because so much of the activity and the events have been happening just centered around these 3 cities, or even disproportionately Riyadh. And we really want to be making sure that we're not leaving the rest of the cities and the towns behind as we move forward. So, from a medical perspective, from a business, from a public and private sector perspective, how do you think, how can we ensure that these people do not get left behind?
Well, with the 2030 vision, the collaborative work of all sectors in the government is working tremendously to not miss out on any opportunity. There's no, they will not leave a stone unturned. So that's one thing. The other thing is that they listen. So it's like, we're going to do this and we will make it happen. So this is one thing that's a unique perspective with the 2030 vision. And people are more than happy to collaborate. They are thirsty for this collaboration and support. And they would do anything and everything possible to make sure that their little town gets the best out of this prosperity that's happening here. And they do great. They're amazing. And I had to realize this and notice this when we were doing the Dakar rally. It's 5,000 kilometers almost going around the kingdom, including the empty quarter.
Wow.
There are areas I never knew existed, but it's just amazing.
And I think, from a public sector perspective as well, yes, the people themselves are excited, but I love to see, and I'm very proud to see how fully, the country embraces the uplift of a city from all angles. So, a place like Al Ula, it's very easy to just sort of make it a tourism hive and then not really invest in the infrastructure or the healthcare or the education there. But you see actually the exact opposite happening, where there's immense investment happening in terms of, how do we make sure that this place has the best education system possible, the best hospitals possible. And it really creates a symbiotic relationship where the kingdom just continues to flourish.
One of the things that the Ministry of Health did is they did this mapping of the healthcare in clusters. So they made them groups. So let's say there's a big hospital and a tiny hospital, that's going to benefit the whole thing. So that's how they're uplifting the medical care in those regions, in those areas. So a lot of regions are now clusters in healthcare, and this is making things really grow fast.
It's incredible. And do you think, is this, because perhaps we have a smaller population, but the public healthcare system here seems to be a lot more efficient in terms of, being able to see more people than compared to, say, long wait times in the US or Europe. It just feels like, a lot of people would actually go for public healthcare, even if they did have the private option. What makes that so good?
What makes that what?
What makes that so good or efficient?
Well, I think it's the fact that everyone that works in the health sector wants to benefit the public. And this is part of the culture. We're a very generous population. We have our cultural background in being kind and generous. So this actually adds things. There's also the fact that we discover the need and we try to cover that need with an alternative and innovative way. So they devise systems to have e-clinics on your phone. So you don't have to really go to the doctor if you're really not that sick. You could just pick up the phone and talk to him via the app. And you could easily book an appointment through Sahati app, for example. There's also the fact that the need for, let's say, not an emergency department per se, but an urgent care clinic. So urgent care clinics are booming, and this boom and these clinics even affected the private sector, and they're even riding that wave faster than the public healthcare system.
And this goes back to sort of the intersection with technology as well, where yes, you have, even I met someone with a startup in dermatology telehealth. So you really see all of these alternative routes, but like essentially ones that cooperate together, flourishing in the kingdom. I'm wondering, what are some of the breakthroughs in medicine that you're most excited about?
Well, we have a lot of AI components that are in the medical field. Uniquely in Saudi Arabia, there's one of the largest AI incorporation with diabetic retinopathy, and by the pioneer Dr. Salwa Al-Hazza. She's an amazing physician, and she made that happen. So they detect early diabetic problems in the eye, and they could escalate and manage this before reaching to a point of blindness. So this really supports this. We have other modalities that are in AI. In my personal work with the ultrasound, we work with ultrasound companies to generate AI models to detect pathology or diseases using the ultrasound scans. For example, like a pneumothorax, we could detect sliding and no sliding. Or if there's free fluid, meaning internal bleeding, in an ultrasound, and that's generated by an AI. And this took a lot of work and a lot of scans. So yeah, there's a lot of things that could benefit. In the radiology department, they have models that detect X-rays and CTs, and they would give you like a red flag and listen to, this might be an early nodule for cancer. Cancer detection is even earlier than prior. So this is all with AI's utilization in the healthcare.
I think to me that actually raises an interesting point of what is the status of health in the kingdom rather than what does healthcare look like? Because I've asked a lot of questions about healthcare, but I haven't really asked about the health here.
So, what do you, do you mean in like perspective of how the population's health?
Yeah.
Okay.
Yeah.
So, well, we're a young population, so we do have a couple of diseases that are apparent here, like in the eastern province or southern region, like sickle cell anemia. So that's one factor. We have a high rate of diabetes, and this is due to inactivity and the diet. And being said, I would really urge people to just walk. It's beneficial for you, and try to refrain from eating, processed food as much as possible. Again, it's just and this is where, for example, the Ministry of Sports did these initiatives that are amazing. You know that there's this big mega project in Riyadh.
Yes. The Sports Boulevard.
Sports Boulevard,
Yes.
Exactly. So the Sports Boulevard's main purpose and goal is to promote healthcare and promote sports and make it feasible and available to have these fields and areas to have a means to do these activities, like areas to walk, areas to ride a bike, some playgrounds, paddle areas, and all that, gyms. This is all part of this movement. And it's amazing and colossal project, by the way.
Yeah, it's great to see, because we're kind of, in a lot of different fields where we have the advantage of being greenfield, where, we haven't done it before. So we get to really experiment with it and do the best. And in some fields, we're trapped a little bit in being brownfield, because so many of the cities, the major cities here were built after, cars became widely available. So you have non-walkable cities by design compared to a lot of places in Europe. But we're actively going back and changing that, which, changing the infrastructure of a major metropolitan hub like Riyadh is no easy feat.
That's interesting. You see, when you go to the Eastern Province or the West Coast, they have more sidewalks than Riyadh City. And because the population there were built for the Eastern Province, there were the expats that used to come here with Aramco and the oil companies and all that. So they made sure that these are available. And in the Western region, the same thing with prior cultures and prior governments way back from, let's say, the Egyptians, the Ottomans, everything, the Turkish Empire. They made sure that their culture came into that. That's why there's more sidewalks in that area. On the other hand, Riyadh has some more technology, more infrastructure, and more of the high-paced upgrades in any city. We're looking for more sidewalks. You could see the changes there. They actually built in and incorporated more sidewalks. For example, Tahliya Street. It wasn't like that, but they made it bigger, better. A lot of areas that they made incorporate, like the boulevard also. The boulevard is in the entertainment sector, but they made it sure that you don't access it via car. You just park your car and go inside and roam the areas. And that's a good workup.
Yeah. The other thing I realized is quite important for, to control the heat is like running water in different places. So fountains just make everything a little bit cooler, and all of these, smart designs that are designed to make it a bit more bearable for us to walk in the heat. And I'm really excited to see what Riyadh looks like in 10 years or so, because I imagine
I think it would look amazing.
City. Yeah. Hopefully with less traffic.
Yeah. That's another issue. But traffic is a major bummer.
Yeah.
But look at the bright side. Have a book. Let the chauffeur drop you wherever you want, and just read that book, do your work, have your office right next to you, and finish a lot of work while waiting in the traffic.
Yeah. Most efficient route. Yeah. Well, thank you so much, Dr. Ahad. This has been an incredibly insightful conversation. Really enjoyed talking with you.
You're welcome.